Attention Deficit Hyperactivity Disorder, ADHD, commonly known as ADHD, is a neurodevelopmental condition that was first described by Dr. George Still in 1902. He identified a group of behaviors in children that included inattention, impulsivity, and hyperactivity. Over time, our understanding of ADHD has continued to develop and expand. One of the primary symptoms of ADHD is difficulty maintaining attention, which often leads to forgetfulness and disorganization. Another major aspect of the disorder is hyperactivity, which can cause restlessness, constant movement, fidgeting, and impulsive behavior. Some individuals experience mainly inattentive symptoms, while others show mostly hyperactive symptoms, and in many cases, people with ADHD display a combination of both. ADHD is caused by differences in brain structure and function, with genetic factors playing a significant role, as the condition often runs in families. In the United States, it is estimated that 5 to 10% of children and 2 to 5% of adults are affected by ADHD. The disorder is diagnosed based on a long-lasting pattern of symptoms that interfere with daily functioning across multiple settings, such as school, work, and home. In the past, ADHD was frequently misunderstood and was referred to using terms such as minimal brain dysfunction. Treatment options were limited at that time. However, by the mid-20th century, stimulant medications such as Ritalin were discovered to be effective in managing symptoms by increasing dopamine levels in the brain. Today, ADHD is typically treated through a combination of behavioral therapy and medication. Despite increased awareness and improved treatment methods, ADHD is still sometimes misdiagnosed or overlooked, especially in adults and girls, because symptoms can present differently among individuals. Although research and awareness have improved outcomes, ADHD continues to be an important topic of social and scientific attention. Eating disorders, often abbreviated as EDs, are serious mental health conditions characterized by an unhealthy relationship with food, body image, and weight. These disorders were first documented in medical literature during the late 19th century, with anorexia nervosa being described in 1873 by the British physician Sir William Gull. However, awareness and understanding of eating disorders increased significantly during the 20th century as more cases were identified, researched, and clinically examined. There are three main types of eating disorders, with anorexia nervosa being one of the most severe. In anorexia nervosa, individuals deliberately restrict their food intake, sometimes to the point of starvation, due to an intense fear of gaining weight and a distorted perception of their body image. Common symptoms include extreme weight loss, obsessive calorie counting, and a refusal or inability to maintain a healthy body weight. Anorexia nervosa is associated with the highest mortality rate among all mental health disorders. Another major eating disorder is bulimia nervosa. This condition is characterized by repeated cycles of binge eating followed by compensatory behaviors such as self-induced vomiting, excessive physical exercise, or misuse of laxatives in an attempt to prevent weight gain. During binge episodes, individuals often feel a loss of control and later experience strong feelings of guilt or shame. Although people with bulimia may maintain a body weight within the normal range, they are typically highly preoccupied with body shape and appearance. The third primary type is binge eating disorder, which involves frequent episodes of consuming unusually large amounts of food in a short period of time, often in secrecy. These episodes are commonly followed by feelings of distress, guilt, or embarrassment. Unlike bulimia, binge eating disorder does not involve compensatory behaviors, which often results in weight gain and related physical health problems. Eating disorders are complex conditions that arise from a combination of genetic, biological, psychological, and environmental factors. Cultural pressure, traumatic experiences, and family dynamics can contribute to the development or worsening of these disorders. It is estimated that approximately 9% of the global population will experience an eating disorder at some point in their lifetime, with women being affected more frequently than men. Treatment for eating disorders typically requires a multidisciplinary approach, involving psychotherapy, nutritional counseling, and ongoing medical supervision. In severe cases, hospitalization may be necessary to stabilize an individual's physical health. Historically, eating disorders were misunderstood and often viewed as issues of self-control or personal choice. Today, they are recognized as serious and potentially life-threatening mental health conditions that require specialized care. With early diagnosis and appropriate treatment, many individuals are able to recover and develop a healthier relationship with food and their bodies. Depression, also known as major depressive disorder, is a mental health condition characterized by persistent feelings of sadness, hopelessness, and a loss of interest or pleasure in everyday activities. The concept of depression has existed for centuries. In ancient Greece, it was referred to as melancholia and was believed to result from an imbalance of bodily humors. During the 19th century, depression became more widely recognized as a psychological condition, influenced by the early development of psychiatry and the work of figures such as Sigmund Freud. However, it was not until the 20th century that depression came to be fully understood as a complex and multifaceted mental illness. Common symptoms of depression include prolonged periods of low mood, persistent fatigue, disturbances in sleep patterns, difficulty concentrating, feelings of worthlessness or excessive guilt, and, in severe cases, suicidal thoughts. Depression can vary in severity, occurring as a single episode for some individuals or as recurrent episodes throughout a person's life. The disorder is caused by a combination of biological, genetic, environmental, and psychological factors. In the brain, neurotransmitters, particularly serotonin, dopamine, and norepinephrine, play a crucial role in regulating mood. Dysregulation of these chemicals, along with abnormal activity in certain brain regions such as the prefrontal cortex, contributes to the development and persistence of depressive symptoms. Depression is a widespread condition, affecting approximately 5 to 7% of adults worldwide each year, with women being more likely to experience it than men. Historically, depression was treated using methods that were often ineffective and harsh, including bloodletting, isolation, and early forms of electroconvulsive therapy. In the mid-20th century, the development of antidepressant medications such as tricyclic antidepressants and selective serotonin reuptake inhibitors, SSRIs, revolutionized the treatment of depression. Today, depression is managed through a combination of medication, psychotherapy, and lifestyle changes. With appropriate treatment and support, many individuals with depression experience significant improvements in their symptoms and overall quality of life. Antisocial Personality Disorder, ASPD, commonly abbreviated as ASPD, is a mental health condition characterized by a long-term pattern of disregard for the rights of others, along with impulsivity and a lack of remorse. The disorder was first widely recognized in the early 19th century, developing from earlier concepts such as moral insanity, a term introduced by psychiatrist Philippe Pinel. Over time, particularly during the 20th century, the condition evolved and eventually became known by the name used today. The symptoms of ASPD include ongoing deceitfulness, irritability, aggressive behavior, recklessness, and a consistent failure to follow social norms, including breaking laws. Individuals with ASPD often show little concern for their own safety or the safety of others and may frequently engage in manipulative or illegal behaviors without experiencing guilt or remorse. A lack of empathy, along with difficulty maintaining long-term relationships or steady employment, is also commonly observed. ASPD is believed to develop due to a combination of genetic factors and environmental influences, such as childhood abuse or neglect. It is estimated that approximately 1 to 4% of the general population may have ASPD, with the disorder occurring more frequently in men, particularly within prison populations. In the past, ASPD was poorly understood and often managed using harsh approaches, including institutionalization. Today, treatment methods are more focused and structured. However, managing ASPD remains difficult. Cognitive behavioral therapy, CBT, is sometimes used to help individuals identify and change harmful patterns of behavior, although therapy is often met with resistance. There is no specific medication approved for treating ASPD, but mood stabilizers or antidepressants may be prescribed to help manage related issues such as irritability or aggression. Despite advances in treatment, ASPD continues to be challenging to treat, largely because individuals with this disorder often do not seek help willingly. Anxiety disorders are a group of mental health conditions marked by excessive fear, worry, and nervousness that significantly interfere with everyday functioning. While anxiety has been recognized for centuries, it was not until the 19th and 20th centuries that it began to be understood as a distinct psychological disorder. Anxiety disorders include several different conditions, with generalized anxiety disorder, GAD, and social anxiety disorder, SAD, being two of the most common. GAD is characterized by persistent and uncontrollable worry about a wide variety of daily life events, even when there is little or no real reason for concern. Common symptoms include restlessness, difficulty concentrating, irritability, muscle tension, and sleep disturbances. In contrast, SAD involves an intense fear of social situations, where individuals may worry about being judged, embarrassed, or humiliated. While GAD tends to affect a person's overall life, SAD is more situation-specific and is primarily focused on social interactions. Anxiety disorders develop due to a combination of genetic, biological, and environmental factors. They are very common, affecting approximately 20% of the population, with women experiencing them more frequently than men. Historically, anxiety disorders were often misunderstood and treated using ineffective or harsh methods, such as institutionalization or the use of sedatives. Today, anxiety disorders are treated more effectively using approaches such as cognitive behavioral therapy, CBT, exposure therapy, and medications including selective serotonin reuptake inhibitors, SSRIs. In addition, mindfulness practices and lifestyle changes play an important role in managing symptoms. Fortunately, anxiety disorders are highly treatable, although many individuals remain undiagnosed or untreated. Increased awareness in recent decades has contributed to better outcomes for those affected. Body dysmorphic disorder, BDD, also known as body dysmorphia, is a mental health condition marked by an obsessive preoccupation with perceived flaws or defects in physical appearance. These flaws are often very minor or completely unnoticeable to others. The disorder was first described in the late 19th century by Italian psychiatrist Enrico Morselli, who referred to it as dysmorphophobia. However, it was not until the late 20th century that the condition became widely known by the name body dysmorphic disorder. Common symptoms of BDD include excessive grooming, frequent mirror checking, constantly comparing one's appearance to others, and seeking repeated reassurance about the perceived defect. These behaviors can cause significant emotional distress and seriously interfere with daily functioning. The perceived flaws often focus on specific body parts such as the skin, hair, nose, or stomach, though any part of the body can become the center of concern. Individuals with BDD may avoid social situations or turn to cosmetic procedures in an effort to correct the perceived imperfection. Research on brain function has shown that individuals with BDD may have abnormalities in how visual information and emotions are processed, particularly in areas such as the prefrontal cortex. BDD affects approximately 1 to 2% of the population, with men and women being equally affected. The disorder commonly begins during adolescence, a period when body image concerns are especially heightened. In the past, BDD was often misunderstood and dismissed as vanity or low self-esteem, and treatment options were limited, sometimes involving hospitalization or ineffective therapeutic approaches. Today, BDD is typically treated using a combination of cognitive behavioral therapy, CBT, and medications such as selective serotonin reuptake inhibitors, SSRIs. These treatments help reduce obsessive thoughts and compulsive behaviors. Despite the availability of effective treatments, many individuals with BDD struggle to seek help due to feelings of shame or denial regarding the seriousness of their condition. Bipolar disorder is a mental health condition characterized by extreme mood changes that shift between manic episodes and depressive episodes. The disorder was first described in ancient times, with the Greek physician Hippocrates documenting mood changes similar to what we now recognize as mania and depression. However, it was not until the mid-19th century that French psychiatrists Jean-Pierre Fauret and Jules Baillarger identified these mood swings as distinct illnesses, initially referring to the condition as circular insanity. During the 20th century, the disorder became known as manic depressive illness, before eventually being renamed bipolar disorder. There are two main types of bipolar disorder, bipolar I and bipolar II. Bipolar I disorder involves severe manic episodes, which may result in risky behavior, a reduced need for sleep, inflated self-esteem, and racing thoughts. These manic episodes are often followed by major depressive episodes, which include symptoms such as hopelessness, fatigue, and suicidal thoughts. Bipolar II disorder is characterized by a milder form of mania known as hypomania, but individuals still experience serious depressive episodes. Bipolar disorder affects approximately 1 to 3% of the population and is most commonly diagnosed during late adolescence or early adulthood. The exact cause of the disorder is not fully understood, but it is believed to result from a combination of genetic predisposition, differences in brain structure, and environmental stressors. Imbalances in brain chemicals, particularly dopamine and serotonin, also play a role in the extreme mood fluctuations seen in bipolar disorder. In the past, treatment options for bipolar disorder were limited and often harsh, frequently involving institutionalization or the use of ineffective sedatives. The discovery of lithium in the mid-20th century marked a major breakthrough, as it proved effective in stabilizing mood swings. Today, treatment typically includes mood stabilizers, antidepressants, and antipsychotic medications, along with therapy to help individuals understand triggers and manage symptoms. Although bipolar disorder is a chronic condition, with proper treatment and ongoing management, many individuals are able to live fulfilling and productive lives. However, maintaining consistent treatment can be challenging due to the nature of the illness itself. Borderline personality disorder, commonly referred to as BPD, is a mental health condition characterized by ongoing instability in emotions, self-image, behavior, and interpersonal relationships. Individuals with BPD often experience intense emotional reactions and struggle to maintain a stable sense of who they are and how they relate to others. The term borderline was first introduced in the 1930s by psychoanalyst Adolf Stern, who described patients as existing on the borderline between neurosis and psychosis. However, it was not until the late 20th century that BPD became widely recognized and understood as a distinct psychological disorder. The core symptoms of BPD include severe emotional instability, an intense fear of abandonment, chronic feelings of emptiness, impulsive behaviors, and unstable or intense relationships. People with this disorder often experience rapid mood swings and have great difficulty regulating strong emotions. In more severe cases, self-harm behaviors and suicidal thoughts are common. Disturbances in identity, such as an unstable self-image or difficulty forming a consistent sense of self, are also central features of BPD. BPD is believed to develop as a result of a combination of genetic vulnerability, childhood trauma, and other environmental factors. Research on brain function suggests that individuals with BPD may have heightened emotional reactivity due to abnormalities in the amygdala, the brain's emotional processing center, along with reduced regulation from the prefrontal cortex, which is responsible for impulse control and emotional regulation. The disorder affects approximately 1 to 2% of the population and is diagnosed more frequently in women. Although BPD is considered a chronic condition, many symptoms can improve significantly over time with proper treatment and support. In the past, BPD was widely misunderstood, and individuals with the disorder were often labeled as manipulative or resistant to treatment. Therapeutic approaches were limited and frequently ineffective, leading some patients to be institutionalized. Today, however, dialectical behavior therapy, DBT, developed by psychologist Marsha Linehan, is considered the most effective treatment for BPD. DBT focuses on improving emotional regulation, distress tolerance, mindfulness, and interpersonal skills. Medications such as mood stabilizers and antidepressants may also be prescribed to help manage certain symptoms, although they do not treat the core disorder itself. Despite the challenges associated with BPD, many individuals experience meaningful improvement and greater stability when provided with appropriate treatment, understanding, and long-term support. Depersonalization, derealization disorder, DDD, commonly referred to as DDD, is a dissociative condition in which individuals experience a persistent sense of detachment from their own body or feel as though the world around them is unreal, distorted, or dreamlike. While brief episodes of depersonalization or derealization can occur occasionally in many people, individuals with DDD experience these sensations continuously or repeatedly, leading to significant emotional distress and difficulty functioning in daily life. The concept of depersonalization dates back to the 19th century, when it was discussed by early philosophers and physicians. However, it was not formally recognized as a distinct psychological condition until the mid-20th century. Symptoms of depersonalization include feeling as though one is observing oneself from outside the body, a sense of emotional numbness, or a lack of connection to one's thoughts and feelings. Derealization, on the other hand, involves the perception that the external world appears foggy, artificial, flat, or dreamlike. Episodes of depersonalization and derealization can be triggered by intense stress, trauma, or substance use. In depersonalization, derealization disorder, however, these experiences occur persistently and often without any clear external trigger. It is estimated that approximately 1 to 2% of the general population may experience chronic depersonalization, derealization disorder at some point in their lives, while brief and irregular episodes are much more common. DDD is believed to arise from a combination of psychological and neurological factors, particularly disruptions in emotional processing and the brain's response to stress. Treatment typically involves psychotherapy, which helps individuals challenge distorted perceptions, reduce anxiety, and develop effective coping strategies. Medications such as antidepressants or anti-anxiety drugs may also be prescribed to manage associated symptoms, although no medication is specifically approved for the treatment of DDD itself. In the past, dissociative disorders like DDD were often misunderstood or overlooked, and individuals were sometimes misdiagnosed with psychotic disorders. Today, with improved awareness and the development of specialized therapeutic approaches, outcomes for individuals with depersonalization, derealization disorder are steadily improving. Dissociative identity disorder, commonly abbreviated as DID and previously referred to as multiple personality disorder, is a psychological condition marked by the existence of two or more distinct identity states within a single individual. Each identity may have its own name, memories, behavior patterns, and personal characteristics, and these identities can take control of the individual's behavior at different times. The disorder was initially recognized in the late 19th century, but it became widely known during the 20th century due to the well-known case of Sybil, a woman who was diagnosed with 16 separate personalities. DID most often develops as a response to severe and long-term trauma, particularly during early childhood. This trauma may include physical, sexual, or emotional abuse. The disorder is believed to function as a coping mechanism in which the mind dissociates from traumatic experiences, leading to the creation of separate identities that help manage overwhelming stress and pain. Dissociation refers to a disruption or disconnect between a person's thoughts, memories, emotions, and sense of identity. Common symptoms of DID include significant memory gaps, episodes of amnesia or blackouts, noticeable shifts in behavior or personality, and difficulties maintaining a consistent sense of identity. Individuals with DID may also experience other dissociative symptoms such as depersonalization, where they feel detached from themselves, and derealization, where the surrounding world feels unreal or distorted. Although DID is considered relatively rare, it is estimated to affect approximately 1 to 2% of the population. The disorder is frequently misdiagnosed as other mental health conditions, including borderline personality disorder or schizophrenia. Historically, DID was poorly understood and often sensationalized, which resulted in ineffective treatments such as long-term institutionalization or inappropriate therapies. In modern clinical practice, treatment primarily involves trauma-informed approaches, especially long-term psychotherapy aimed at integration and stability. While there is no medication specifically designed to treat DID itself, antidepressants or anti-anxiety medications may be prescribed to help manage associated symptoms. Although DID is a chronic condition, with appropriate and consistent treatment many individuals are able to develop a more stable sense of self and significantly improve their overall quality of life. Narcissism, or Narcissistic Personality Disorder, NPD, sometimes abbreviated as IMPD, is a personality disorder characterized by an exaggerated sense of self-importance, a strong need for admiration, and a lack of empathy for others. The idea of narcissism originates from ancient Greek mythology, specifically the story of Narcissus, a young man who fell in love with his own reflection. In the modern psychological context, psychoanalyst Sigmund Freud introduced the term in the early 20th century to describe self-obsession as a part of human development. The symptoms of NPD include grandiosity, a constant need for attention and validation, fantasies of success, power, or superiority, and a strong belief that one is better than others. Individuals with NPD often display manipulative or exploitative behaviors in relationships. They expect special treatment and admiration but have difficulty understanding or caring about the feelings of others. Such individuals are highly sensitive to criticism and may respond with anger, defensiveness, or hostility when their self-image is threatened. Narcissistic personality disorder is believed to develop due to a combination of genetic factors, childhood experiences, such as excessive pampering or emotional neglect, and environmental influences. Many people with NPD hide their deep insecurities behind outward displays of confidence, arrogance, or superiority. This disorder affects approximately 1 to 2% of the population and is more commonly diagnosed in men. NPD can have a serious impact on personal relationships, professional life, and social functioning. Despite these difficulties, many individuals with the disorder do not seek treatment because they do not recognize their behavior as problematic. Historically, narcissism was often dismissed as mere arrogance rather than being acknowledged as a legitimate mental health condition. Treatment for NPD remains challenging, as many affected individuals resist accepting responsibility for their behavior. Psychotherapy and psychodynamic therapy can help individuals with NPD develop greater self-awareness, improve emotional regulation, and strengthen interpersonal skills. There are no specific medications designed to treat NPD. However, treating co-occurring conditions such as depression or anxiety may be beneficial. Although narcissistic personality disorder is difficult to treat, long-term therapy can lead to personal growth and improved relationships for those who actively engage in the treatment process. Obsessive-compulsive disorder, commonly known as OCD, is a mental health condition marked by persistent, unwanted thoughts and repetitive actions that a person performs to reduce the anxiety caused by those thoughts. The concept of OCD has existed for centuries. During the Middle Ages, people experiencing obsessive thoughts were often thought to be possessed or influenced by supernatural forces. In the 19th century, French psychiatrist Jean-Étienne Dominique Esquirol made an important distinction between general madness and conditions that would later be identified as OCD. In the 20th century, a clearer understanding of OCD developed. Obsessions in OCD can include intense fears of contamination, worries about safety, or disturbing intrusive thoughts about harming oneself or others. To manage the distress caused by these obsessions, individuals perform compulsions, which are repetitive behaviors such as excessive washing, repeated checking, counting, or silently repeating words or phrases. These actions are meant to reduce anxiety, but over time they often become distressing themselves, as they take up significant amounts of time and mental energy. OCD operates through a cycle of anxiety. Intrusive thoughts trigger discomfort and fear, and compulsive behaviors provide temporary relief from that anxiety. However, this relief does not last long, and the brain learns to rely on the compulsions, which strengthens the cycle and causes it to continue. As a result, individuals may feel trapped in repetitive patterns that are difficult to control. OCD affects approximately 2 to 3% of the population and usually begins during adolescence or early adulthood. It impacts both men and women at equal rates. Historically, OCD was widely misunderstood, and people with the condition were often labeled as overly anxious or emotionally unstable. Early treatments were extreme and included institutionalization and electroconvulsive therapy. Today, however, effective treatments are available. Cognitive behavioral therapy, particularly a method known as exposure and response prevention, ERP, is considered the most effective psychological treatment for OCD. In addition, medications such as selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed to help reduce symptoms by influencing serotonin levels in the brain. With proper treatment and support, many individuals with OCD are able to manage their symptoms successfully and lead productive, fulfilling lives, although for some people the condition may remain chronic. Paranoid personality disorder, commonly abbreviated as PPD, is a personality disorder characterized by persistent distrust and suspicion toward others, often without clear or sufficient evidence. Individuals with PPD frequently believe that people around them intend to harm, deceive, or take advantage of them. Although PPD was formally recognized as a mental health disorder in the early 20th century, descriptions of similar symptoms can be found in earlier psychological writings. People diagnosed with PPD typically show consistent patterns of suspicious behavior. These include a strong belief that others are exploiting or misleading them, an unwillingness to confide in or trust people, and a tendency to hold grudges for long periods of time. They often misinterpret harmless comments or ordinary situations as deliberate personal attacks and may respond with anger, defensiveness, or hostility as a result. The exact cause of paranoid personality disorder is not fully understood, but it is believed to develop from a combination of genetic predisposition, environmental influences, and psychological factors. The disorder usually becomes noticeable in adulthood and appears to affect men more frequently than women. It is estimated that around 2 to 4% of the general population may have PPD. However, many cases remain undiagnosed because individuals with this disorder are often unwilling to seek professional help due to their deep mistrust of others. Treatment for PPD primarily focuses on psychotherapy, which aims to help individuals recognize, question, and gradually change their patterns of mistrust and negative thinking. While medications may sometimes be prescribed to manage associated symptoms such as anxiety or depression, they are not considered the main treatment for PPD itself. In the past, treatment approaches were more basic and often involved long-term hospitalization, but this is now rare. Although understanding and managing PPD can be difficult because of the person's intense suspicion, therapy can play an important role in improving interpersonal relationships and overall daily functioning. Post-traumatic stress disorder, commonly known as PTSD, is a mental health condition that develops after a person experiences or witnesses a traumatic event such as war, physical or sexual assault, natural disasters, or serious accidents. Individuals with PTSD often suffer from intrusive memories, flashbacks, nightmares, and intense anxiety that are directly linked to the traumatic experience. They may also avoid certain places, people, or activities that remind them of the trauma and can feel emotionally numb, disconnected, or detached from others. Although PTSD was officially recognized as a clinical disorder in the 1980s, the idea of trauma-related psychological distress has existed for centuries. During World War I and World War II, similar symptoms were commonly described as shell shock or combat fatigue. Even earlier, comparable conditions were mentioned in medical literature and historical writings under terms such as soldier's heart and battle fatigue. PTSD affects approximately 6 to 7% of people at some point in their lives. However, certain populations, including military veterans and survivors of physical or emotional abuse, experience significantly higher rates of the disorder. PTSD develops when the brain's fear processing system becomes overly sensitive, leading to exaggerated stress responses long after the traumatic event has ended. In this condition, the amygdala, which is responsible for detecting threats, becomes highly active, while the prefrontal cortex, which helps regulate fear and emotional responses, becomes less active. This imbalance reduces the brain's ability to control fear and anxiety effectively. Treatment for PTSD typically includes psychotherapy, along with eye movement desensitization and reprocessing, EMDR, a specialized therapy that helps individuals safely process and integrate traumatic memories. Medications such as selective serotonin reuptake inhibitors, SSRIs, are also commonly prescribed to manage associated symptoms like anxiety and depression. In the past, individuals with PTSD were often misunderstood, stigmatized, or dismissed, and treatment options were limited and largely ineffective. Today, increased awareness, early diagnosis, and the use of evidence-based treatments have significantly improved outcomes, allowing many individuals with PTSD to recover and regain a sense of stability and well-being. Schizophrenia is a chronic and severe mental health disorder that affects the way a person thinks, feels, and behaves. It often causes a distorted perception of reality, including symptoms such as hallucinations, delusions, and disorganized thinking. Individuals with schizophrenia may also experience difficulties with speech, reduced motivation, and a lack of emotional expression or emotional flatness. The understanding of schizophrenia has evolved over many centuries, but it was formally identified as a distinct mental disorder in the early 20th century by Swiss psychiatrist Eugen Bleuler, who introduced the term schizophrenia in 1911. Prior to this, the condition was known as dementia praecox, a term used in the late 1800s to describe early-onset psychosis. Today, schizophrenia is recognized as a spectrum disorder, meaning it presents a wide range of symptoms that can vary greatly in type and severity from person to person. Schizophrenia affects approximately 1% of the global population and most commonly begins in late adolescence or early adulthood. Although the exact cause of the disorder is still unknown, it is believed to result from a combination of genetic vulnerability, biochemical imbalances, and environmental influences. Research using neuroimaging techniques has identified abnormalities in brain structure and functioning, particularly involving the dopamine system, which plays a key role in regulating mood, perception, and cognition. Treatment for schizophrenia typically involves a combination of antipsychotic medications and psychotherapy. Antipsychotic drugs are used to help control symptoms such as hallucinations and delusions, while psychotherapy focuses on improving coping strategies, social skills, and overall functioning. Cognitive behavioral therapy and family therapy are commonly used to support both patients and their families in managing the condition. In particular, second-generation antipsychotic medications are often prescribed because they are effective in reducing psychotic symptoms with fewer side effects. In the past, schizophrenia was poorly understood and frequently treated in inhumane ways. Individuals with the disorder were often institutionalized and subjected to harsh treatments such as electroconvulsive therapy and even lobotomy. As a result, many patients faced severe stigma and social isolation. Today, however, advances in medical research and therapeutic approaches have led to a much better understanding of schizophrenia. It is now recognized as a manageable condition, and with appropriate treatment and support, many individuals living with schizophrenia are able to lead meaningful and fulfilling lives. Thank you very much for watching this video. If you learned something new, please make sure to leave a like and share your thoughts in the comments below. Don't forget to subscribe if you would like to see more videos like this. Thank you again, and goodbye.